popular diabetes drug, Avandia, is back under the microscope, and for many patients, no longer available. The FDA is restricting who can take it because of concerns of heart problems. Dr. Nishi is with us from Los Angeles. Dr. Nishi, good to see you.
Thank you. It's good to be here.
If you have been prescribed Avandia for a period of time before this latest change, will you still be able to stay on Avandia, or what kind of restrictions are in place now?
Well, there are a couple of restrictions placed on Avandia by the FDA. If a patient is currently taking Avandia, they can continue taking Avandia for the time being, but it is recommended that that patient seek the advice of their physician to look for another alternative, such as Actos, which is in the same drug family as Avandia.
Okay, and then, you know, Avandia apparently is not the only thing in question right now. Avastin, which is one used usually for cancer patients. What options do they have now? Are the same kinds of restrictions being imposed on Avastin?
It's a little bit of a different story with Avastin. Avastin has not been shown to be dangerous to patients or to increase any risk of severe illness. With Avastin, what they found in recent studies was that there does not seem to be as much of a benefit as was once thought. And so Avastin has had preliminary approval by the FDA, but the FDA is now taking a step back and deciding whether or not to give them full approval for use for breast cancer or to actually pull it completely from the market. And so it's a little bit unclear as to what will happen with Avastin.
Okay, so now it brings into question for a lot of patients, you know, who are hearing from their doctors, you need to take this specific drug for this particular ailment. Then you take that prescription to your pharmacist, and either you're giving an option of brand name or generic, or sometimes it's just dispensed to you. What kind of power do you have as a patient to say, I want exactly what my doctor has given me, because there's a likelihood even that generic may not have the same strengths or benefits as that brand name, right?
Right. There are a couple of things a patient can do. First of all, generics are generally equivalent to brand names, but in some cases there are some differences. And so if a patient insists on having a brand name drug, what they would really have to do is convey that to their physician, and the physician would then have to lobby on the patient's behalf to the insurance company, typically by writing a letter recommending that the drug not be replaced with a generic, and I've done that for my patients as well.
So oftentimes that's pretty effective. That means there's got to be some direct dialogue between doctor and your insurance carrier.
Absolutely.
Okay, and is there, I guess, any leverage when you call your insurance company as well and say, you know, I really want what my doctor is prescribing for me, I really don't want the generic, or I don't want to take the recommendation of the pharmacist or from your office, I want to hear from my doctor on this?
Right, I think it helps tremendously when the physician advocates on the patient's behalf. When a patient goes to a pharmacy and requests a brand name medication, they don't really have that much leverage. Oftentimes, I just have to call the pharmacy and explain that this patient absolutely needs to have the brand name version, and that may be adequate. If that is not adequate, then it may require a phone call or a letter from myself to the insurance company, and that is usually effective in allowing the patient to receive the brand name drug over the generic.
And sometimes what's standing in the way of getting that brand name is the cost. Perhaps it's a lot more affordable to take a generic, or what the pharmacist might be able to recommend. So what do you do as a patient to try to get, I guess, that designer drug at an affordable price? What are your options?
Well, there are a couple of options. Namely, price, as you mentioned, is the difference between a generic and a brand name drug. So there are a few things that a patient can do. The first thing actually would be to look for or request a generic form of the medication that has been prescribed to you, because that is often significantly less expensive than the brand name. The second thing that patients can do is to look for an over-the-counter alternative to the drug that they've been prescribed. And an example of that would be Prilosec, and a second example would be Claritin. These are two drugs that are over-the-counter, but there are also prescription versions of these medications as well. The third option would be for the patient to look to online pharmacies to purchase their prescription medications, and that can also be of a significant cost savings. You do have to be careful, though. You want to make sure that you're getting the correct medication. You want to make sure that the online pharmacy is accredited and certified, and that can be done by looking online. There are websites that will help to determine if an online pharmacy is accredited. And the last would be whether or not you need the medication immediately. If it's something that you need very quickly, you may not want to order it online because it can take a few days to even a few weeks to receive. So you just have to keep that in mind.
Dr. Nishi, thanks so much for joining us from Los Angeles. Appreciate the tips. Great advice.
Thank you very much for having me. Bye-bye.
All right, the top 10 CNN heroes have now been chosen.